Hello, everyone. Welcome to the Non-Surgical Penis Enhancement podcast. We're here to discuss about achieving the goal of a 6-inch girth without surgery. And we have as our special guest, Dr. Casavantes. Hi, Dr. Casavantes.
Hi, how are you doing?
Very good.
Great.
So what are you going to talk about today?
Well, this is a podcast meant for beginners, for those guys interested in bigger penis that don't know anything about it. Those guys that have experience, that have done their research and that have done the procedure, they will probably find this podcast as a very basic, but it's meant for that exactly, to as the first contact, as the first, let's say, training for somebody that wants to increase the size of their penis.
Okay, very good. So I'm very sure a lot of new people are going to be excited to know about all this information in order to get a bigger penis in a non-surgical way, which is the safest, right?
Correct. This is exactly about that, non-surgical penis enhancement. You know, social ideas and the trend, for some reason, cultural and social expectations have defined the ideal penis size as 6 inches in length and 6 inches in girth. Mm-hmm. So based on that, because statistically, the human penis is not that big. Mm-hmm. Of course, there are some that are bigger than that. Mm. But most people, the average guy, is a little smaller than that. Mm-hmm. But for some reason, as I said, cultural expectations push the guys to look for a 6x6. Mm-hmm. Non-surgical girth enhancement can give, depending on how the guy is in the beginning, naturally, most of them can achieve a 6-inch with fillers. We're going to talk about it later. And of course, the length is surgical. And we don't do that here. We're not going to discuss that because this podcast is about non-surgical solutions.
This podcast is about the safest route for a man to get a bigger penis.
Correct.
Non-surgical would be the answer.
I'm going to touch for just a second. I don't want to go in detail on this, but I'm going to touch what it is or what it was increasing the size of a penis before we had the soft tissue fillers, which was the surgical phalloplasty or the surgical penile girth enhancement, which is a totally different story. There are two different approaches. The surgical, that is basically out of trend anymore. No, you can still get some surgical procedures there to increase the size of the penis, but the new thing, and the safest thing, is the non-surgical approach. We can see here we have three basic approaches when we speak about surgical approach. The first one is FFT, which is free fat transfer, that consists on doing a liposuction, and then that fat gets prepared, gets manipulated, and then it is reinjected in the penis. The second one is we're talking about the degloving the penis and putting a scaffolding under the skin and then restitching the skin. And the third one is same thing. The penis has to be degloved, and then they put a silicone scaffolding, and then they restitch. Of course, the three of them are very, very aggressive, and the chances for deformity and complications are really high.
Yes, I'm already scared by looking at the pictures and just thinking about it. It just is a no-no for me.
Right.
And probably for any man, some desperate men. But hopefully, after this podcast, they'll know that this is not the route for a safe way. Doctors don't recommend this, right?
Right.
Only bad doctors, we may say that, recommend this. So just be cautious about it.
Yeah, it's like when they do the FFT, that fat is going to die because it relays on the blood flow of the penis to stay. So how much is going to die, how much is going to stay, we don't know. Mm-hmm. So typically those guys end up with a lot of irregularities because the fat dies in some places and doesn't die in other places and so on. And the other ones, deglowing the penis is really something that we don't even want to talk about.
Correct. Yes. It's pretty scary.
The non-surgical approach has a lot of advantages. It's not just avoiding the surgery. There are many things. First, is an outpatient procedure. You don't need to go to hospital for this. The anesthesia is applied locally. We just go to the base of the penis and numb the whole penis by numbing the nerves at the base of the penis. You can do progressive injections, which means it's not only one procedure. Like with surgery, you do one procedure and let's see how it goes. Here you can always increase, correct, add to get the best results in subsequent sessions. Then, of course, it doesn't involve any cuts, drains, stitches, permanent scars, and things like that. And the pain associated with the non-surgical approach is minimal. It's just pain during the anesthesia, and basically that's it. The next day, the patient is sore but not in pain. Different from the surgical approach, that the pain and all the stitches and everything, the process goes for 2 weeks or something like that. And finally, in the end, the patient goes back to normal activities pretty much the same day. They need to take care of certain things, but they basically go back to their normal activities, provided that they're not strenuous activity involved.
Wow. So how much is a quick return to their normal activities? They can walk, they can just do anything else afterwards, right? Not like they have to stay in bed and not move for a month.
Nothing immediately. We have had patients. It's not the ideal thing, because in the end, it is a procedure, and we require the patients to stay in the area, to stay around for at least 1 day, so we can check on them, check on their post operative conditions and everything. But basically, they can go work the same day, or the next day, the very next day.
Yes, definitely the safest route to take.
Yeah.
So what's an ideal candidate? Who can get this non-surgical route solution, and who is not able to do it, or who is in the middle of yes, but you have to take these cautions?
We classify our candidates like ideal, less than ideal, and non-acceptable. Basically, the edges of how can I say this? Very young, very old is not acceptable. Like, we need the patients to be at least legal age to take their own decisions.
18 years or older.
18 years old or older. Since we have, and we will talk about it later, but since we have 3 different options of longevity and 3 different products, we can take from 18 and on. If we're talking about one of the options, which is the permanent one I do not recommend it for people younger than 25, when they are more secure, more aware of what they want. Because a permanent body modification is not too good when you're too young, because you can change your mind easily. So we'll talk about.
So this is more a psychological thing, just matureness in mentality, so you can take a decision of permanent. It's not like it's dangerous for your body at 25 or below. It's more a moral, psychological aspect, right?
Right. Like, we have had kids that they turn 18 and the next day they're here, right? And they want to have this big penis, and we need to do a little bit of psychology there and say, hold on, think about it. Look, these are the options. Why do you go for a temporary one? And when you're 23, you take another. You decide again if you want to do this. and turn it to a permanent thing, and so on. I mean, of course, it all depends on the individual, because sometimes we're very mature at 18, sometimes we're not mature ever. So it all depends, right?
So for Americans, they don't have to be 21 or older. They just need the 18 years or older. Because
18 years old
that's
or older.
that's a good
Yes.
age for medical reasons to they can start.
Mhm.
But for their own journey, for their own life purpose journey, it's ideal that you choose to modify your body permanently at 25 or
25, let's
yes,
say.
right.
Yeah.
But you can still go for the other temporary or long-term options when you're 18. If you're so desperate to do it already for your girlfriend or just your sex life, the two routes which we're going to mention more ahead, it's the temporary, right? Or the long-term.
Correct.
Correct.
Yes.
Okay.
Yeah. So basically, health is I mean, age is a big issue. Health is another one. Sometimes, and this is based on our experience that we made these criteria. Sometimes we have patients that are dealing with different diseases like diabetes or immune diseases where fillers are not recommended.
And this is young people we're talking about, right?
Young people, yeah.
Young people. Okay.
Yeah. So the individual has to be healthy in general to receive this treatment. Circumcision, that's a big thing too. The results in a patient that is circumcised versus the non-circumcised are totally different. The approach is different, the results are different, and everything. So ideally, the patient should be circumcised. And those that are circumcised ideally should be low and tight circumcision. We will go in detail on this too later.
Okay.
Of course, we need patients that are psychologically stable. This is, the penis size is more psychological than physical. There's a syndrome that most of us, like acne, most of us have some degree of acne. Some of us, all of us, have some degree of what is called the small penis syndrome. It's not a small penis, it's a small penis syndrome. Is what we see, right? We have patients that are way bigger than the average, and they have small penis syndrome, right? Is what you see, is that you think that your penis is small. And a big percentage of our population falls into that category, right? So, and it works because you can go to the shrink, you can go to the psychologist, and the psychologist will do his best effort to convince you that your penis is normal or even big. But what you will see the same thing. They come here, they get it bigger, and they get cured immediately, right? Another thing is we need patients to be knowledgeable about the procedure. We need patients that are completely aware of what they're doing, that understand the difference between the fillers, that understand the consequences of the filler and the procedure itself. And another thing that we require is that the sexual partner, if there is one or several, the sexual partner is aware of what he's doing. I'm going to quote an example here. This guy wanted to surprise the wife by getting a bigger penis without telling her. And when he went back very proud with his new size and everything, the wife hated it.
Oh.
Yeah, and
It was too big?
it was too
Mhm.
big. And he told her, "But you got a boob job. Why? How come I cannot get this?" Says, "Because you're not going to put my boobs inside your body."
Yes.
Right.
Correct. Yeah.
So it's very sensitive. It's something that has to be considered to check on on the sex partner.
Yes, men need to really think about doing this, and the problem is not doing it. The problem is you exaggerate the volume, which it gets to a point where you can hurt your partner, or it doesn't even fit in, and it's more bad reaction now from your women or your wife or your girl, because now she doesn't want to be with you physically. So that's bad news. That's bad news for you, because now you're all alone with a bigger penis, but nobody wants to be with you, and you don't want to be living with that. You want to have a regular, healthy volume, and always just talk to your partner or your girlfriend and say, "Hey, I'm going to grow this amount. Are you okay with it? Are you going to enjoy this?" And if she says yes, then go on and come to the doctor. But if she says this is too much, the doctor recommends that don't do it. Don't exaggerate your volume, because it's been proven all along of all these 15 years that women are not going to be happy you have an exaggerated volume on your penis.
Exactly. That's the name of the game here. I always tell my patients the name of the game when it comes to phalloplasty or to aesthetic procedures, medical procedures, is moderation. It's like
moderation.
yeah, if the trend is to have no nose, it's crazy because the trend is going to change tomorrow and you have no nose, right? If the trend is to have an 8x8, first of all, I don't think you're going to find too many to play with. And second of all, the trend is going to change, and then you're stuck with something that is not trendy. So basically, it is, as our procedure is named, Girth Enhancement. We don't want the girth monstrification, right?
Yes.
And
How many cc's is that? What's a healthy route? 20 cc's and that's it, or you can go 20 cc's plus a little bit more and that's fine. What have you seen
yeah,
that works for
it's
them?
very variable, like everything in the medical field. It all depends on the size, on the original size of the patient. It depends on his expectations, but it also depends on the filler that we use and depends on the technique that the doctor uses. But I will say, not talking about inches, but about, I mean, not talking about the volume, but about measurement. I will say nobody will regret having half an inch extra. But the moment we go beyond 1 inch, things are going to start happening. More possibilities for complications, more deformity, and less volunteers to play.
Oh, okay, very good, interesting. What about they've been talking about a lot on several forums that I've seen about penis enlargement and girth enhancement. They always talk about the dispute between what's the best part of the penis to have more volume. You know, on the top of the penis, because it's touching the woman's body on the top, or the sides, or the sides of the penis because it's touching the sides of the women's body, or under, which is also touching the vagina under. What have you found that is the best um, um, option for women that they prefer? I want more volume on the top, on the sides, or under.
Well, it's kind of a tricky question because I will say, if it was my decision, I always talk with the patient about his expectations and the possibilities and the limitations and everything. What I will consider mostly is the original shape of the penis, because there are different shapes. There are baseball bat penises where the base is very thin and the distal part is very wide, or vice versa, triangular penises, or you name it. So what we try to do, as much as possible, because the fillers are not, we're not carving a piece of wood or something like that. So we need to consider how the filler will settle and at the end. But let's say if the base is too thin, well, I'll concentrate on the base. If the top is too thin, I will concentrate on the top or something like that. I will try to get to a cylindrical one. Cylindrical one. Now, there's a tricky thing there. The lower part of the penis, where the urethra runs, shouldn't get any fillers, because the urethra. I mean, we all know. We all know, right? You touch the under part of the penis, and you feel soft there. You feel
Okay. Yes.
an area that is soft.
And
right?
it's soft for a reason.
Is of a reason. Is where the urethra runs, and there's no room to put fillers there. And if you dare to put them, you're going to push the urethra, and you're going to interfere with ejaculation or simple urination. So that part has to be free of it. So best case scenario, we could go oval or kind of circular, and compensate with the areas that where the patient, the specific patient, is naturally lacking.
Yeah, I mean, basically, a woman visually is going to see your penis, and she's not going to go crazy under. Oh, let me see your urethra if you have it big there. I mean, if she can get a big glimpse at the tall building in front of her just by looking at it. So, just an overall oval work with the fillers, they're going to be just fine.
Right. Yeah.
A lot of people are commenting on the forums about girth enhancement and PE, about under the shaft. What's that about? What's getting fillers under the shaft? Because there's been a lot of people going for that. But what is that about?
There are two limitations, very important when it comes to fillers for the penis. Very important limitations, and I will always stand strongly for them. We are very limited in the lower part and the ventral part of the penis, of the body of the penis, and the shaft, and we are very limited with the glands. Why? Because there's no space to fill in, and you push the product, and you're going to force it into something else. I've seen big ulcers and scars in penises, in glands, where the doctor tried to push way too much, and way too much is very little.
Okay.
Yeah. And same thing with the urethra. So I do not touch the area of the urethra, and I go very, very limited in the glands, because if you force filler in the glands, it's not only going to compromise the circulation of the area, but you're also going to inject it into the bloodstream, and it's going to go somewhere. It's going to create a clot. So those are no for the penis.
Yeah, and this is coming from a doctor that's been 15 years plus more doing this job, basically the pioneers on this technique. So if the doctor says avoid that area, it's for a reason.
It's for a reason.
It's for a big medical reason. It's just not, I mean...
It's not about just putting fillers, right? Our medical criteria has to prevail over the sometimes nonsense expectation of the patient. And you need to explain, and we need to explain, and we need to tell them, look, this is the reason why. Of course, there are patients that won't get it and won't understand, and they will... I have had patients, there's a forum there, and this guy, I think, was called Godzilla with penis, something like Pencilla or something like that, because he wanted a Godzilla instead of a penis. I was like, don't count on me. don't come here for that, right? Yeah.
Right. Yeah, so this is basically for the patient's safety. Not we're putting the safety of the patient first, his health, his body. We're putting it top priority, and not profit just to get more fillers. We're being conscious about it and just say we don't want to win any extra money in putting your health on risk.
Exactly. Our responsibility as physicians goes beyond the procedure itself. You need to consider and you need to discuss with the patient and you need to convince the patient of some things. If they don't get it, then they go to the category of no good patients for the procedure, because our we need to be a vigilante. We need to be a good judge if the patient is able to get the procedure, if he's stable, psychologically stable, etc. And we need to make sure that we're going to not create damage immediately or in the future. And so we need to foresee everything that could happen.
Yeah, this is the health of your penis. Why would you put at risk your penis and your health and your sexual activity
Exactly.
for just a little bit of more volume that your wife or your partner is not even going to care about?
Right.
If you just want something under their toys, I mean, you already have a nice volume that you put on with the fillers in a healthy way and responsible way.
Mhm.
If you just want a little bit more, you can just be playful and toys. But the reality is your partner is not going to care about that little thing under just the shaft, and you're only putting your penis at risk. So
Correct.
why do that? It
Exactly.
just doesn't make sense.
Exactly.
So what options do we have? So if somebody wants to or I want to just make the procedures, so the next step is to ask you which type of filler do I want and what type of fillers, what are our options?
The medical field, I was here when we started using fillers, soft tissue fillers. The FDA, the FDA approved collagen as a filler back in 1990, I think, something like that. But it's a filler that you put it and you turn around and it's gone. The longevity was horrible in that product. Then we started having different fillers and stuff. And nowadays, and for the specific indication of penis enlargement, we have three basic different fillers. And we classify them for their longevity. We have one that is short lasting. We have one that is longer lasting. And we have one that is permanent. We offer the three of them here at Avanti Therma.
Is it available all around the world or is it just in certain countries?
No, in certain countries we have we offer the three of them because we can in Mexico, but in the US, in Europe, they only have one or two. We have three. And the most common one is hyaluronic acid. Hyaluronic acid is a gel that absorbs water, and when you inject into the tissues, it absorbs water and creates volume. But it's a volume that can be spongy, soft, and it lasts very short time. Sometimes it lasts a few months. Sometimes it gets like a year or something, but it's short-lived. And again, is a soft filler based in water, so it's kind of like soft. Then on the other edge, we have the permanent one, which is linea or PMMA, and linea has little spheres that once they are inside the tissues, they promote the formation of collagen, not water, collagen. And collagen surrounds each microspheres and creates volume. But it's a volume created by the own tissues of the patient. So it's firm and natural to the touch, different from the other one, right? And in between of them, we have probably what is becoming the ideal filler for the penile enlargement, which is a lance. A lance is also made of microspheres like PMMA. But these microspheres get absorbed little by little. And eventually, years after the injection, eventually it will dissipate and disappear. And the patient goes back to basic to his basic conditions. So we have three players here. Something that can be there for a few months, in that you can reverse with injections. You can reverse it if the patient doesn't like it. Then we have the midterm that lasts for a few years and is not reversible, but it disappears little by little. And we have the permanent. Okay. Now, what is common between them? Well, this is important for the patient to know. HA is going to absorb water. The other two are made of microspheres, and those microspheres get surrounded by collagen. That's a totally different mechanism.
Yes, it is.
Right. And we have the three options. So I was mentioning in the beginning that a young guy, an 18-year-old, in his first day of being an 18-year-old, comes and wants penis augmentation. I will use HA, right? Because I said, okay, you're going to get your penis bigger and it's going to go away. So you're going to be able to judge and have a little bit of experience before you decide on a long-term or on a permanent one.
Yeah. Or he can get a lens, and
Or
he can just enjoy a good 5 years. 5 good years, which is nothing. And at 25, when they reach the mature age, they can come now and see,
and switch to.
I can get the permanent, or I'll just get another lens for another 5 years. And
exactly.
That's it.
Yeah.
What's available in the US?
The US, the only one available is HA. That's it.
Only HA?
Only HA.
Only the 6 month, and that's it?
Yeah, 6 months, 1 year.
And it's probably
14
very
months.
expensive. Very
Yes,
expensive
it's
HA in the US, unfortunately.
Excellently. Yeah.
I've had a lot of friends that have gone to the HA route. They spend thousands of dollars, 10K, 20K, in just 1-2 years.
Right.
10 to 20.
And sometimes
Case.
even a few weeks.
Exactly.
it's
Yeah,
gone.
exactly. And all that money for just 1 year of glory and volume.
Right.
I mean, it just doesn't make sense to spend a lot of money when you have a lens and it is going to last you 5 years. And I bet it's not even compared to the price of HA 10K. You
Right.
can get a lens at how many
It's
dollars?
comparable. Elance and HA will go for the same price. And the other one is even cheaper. The permanent one is a little cheaper.
Oh, in Mexico.
Yeah.
Because it's probably has more years, right? Already in the market. And
Yeah,
you
it all depends. You know,
production.
the problem with HA is that everybody in the world wants HA. So of course the price is a lot of demand. The price goes up, and is what happens with HA. Since it is very safe for the physician, HA is extremely safe because if the patient doesn't like it, you just put an injection, it turns into water, and it disappears.
But it's not safe for your pocket because
It's not safe for your pocket.
It's really expensive in the US,
Right.
HA.
Exactly.
No,
Exactly.
it's just crazy stories.
Yeah.
Why would you pay 10K, 20K for something that's going away at 6 months?
Yeah. In reality, it's a safety. How do you say that? It's an insurance. You buy insurance, both the doctor and the patient. You don't like it, you dissolve it, and that's it.
And a lens, I can probably get a lens for 5K and something around that.
Yeah, right.
5K, and I have 5 years of it.
Right.
4 years of it.
Yeah.
Without me spending never 10K, 20K on just 1 year.
Right.
You know, I think that's the Mexican paradise formula. You can get a good amount of lens for not even half the price of what you would pay in the US.
Mhm.
You can just take a plane. They pick you up at the San Diego airport. They drive you all the way to Mexico to your hotel. You get a nice view, a nice hotel, nice Mexican food, and you save a lot of money. Now they take you back to the San Diego airport. You never move the finger, and you just go back home. You save a lot of money again, and you have a bigger penis for 4 years.
Correct.
or that you can just get the permanent one, right?
or the permanent.
That's
Yeah.
that's the route that a lot of patients have taken in.
Right. Yeah. A lot of patients, a lot of guys don't feel comfortable with a permanent modification. That's fine. That's why we offer the three options. And of course, none of them, if we had one that was perfect, we wouldn't be offering the other ones, right? Every option has its pros and cons. So whatever fits the individual better is what we use. But we have a lot of versatility compared
Yes.
to any other clinic in the world that they only have or one or two.
Yeah, for any guy that wants to make this happen, you have to fly, take a plane to whatever clinic you choose. But I wouldn't be comfortable taking a plane, even if it's just 1 hour away. But I'm going to pay 10K, 20K just for something that's lasting 6 months.
Right.
I would much rather just prefer an airplane flight that's 3 hours, 3 hours, 2 hours. But I'm gonna get a good deal, and I'm going to get a whole lot of volume and a whole more time for what I'm paying.
Right.
So it just makes sense for these Elance or Linea Safe. Just it's just a better route for me, and I'm sure that's why a lot of guys are choosing this over just the old method of HA and putting in the syringe every 6 months, and
Right.
paying 10K every 6 months. It just is nonstop, and it's why do that? I understand now why a lot of patients of yours are just going with the
Or the
Elance or
permanent
Linea
option.
Safe.
Yeah. Yeah. Now to summarize this, we have three fillers, but we have two that work very similar and one that is totally different. HA is the different one.
Mm.
Why? Because it creates a water-based implant that is soft and is very temporary. And the other ones are made of microspheres. Elance and PMA are made of microspheres. And they last either years or permanent. So with that, we can play and we can we can give the patient exactly what he needs or what better fits him, right? Now, what happens with the microspheres? And this is the crucial difference. A gel is a gelatin, watery gelatin that will get absorbed soon. Microspheres, we see here in the left that microspheres are totally cylindrical, 40 microns in diameter, and those are in vitro before the injection. On the right side, we see the microspheres when they have been injected. In collagen, look at the green and purple. Collagen has formed around them, and
Yes, I
that
see
is
it.
what forms what makes the volume. So it's a very stable, very firm implant.
So what can you talk about? Can you talk about the technique that you use at Avanti Derma for the 6-inch girth root?
Yes, we developed this technique. We started in September 2007, was our first patient. And I got trained in Brazil, but turned out to be that I was doing the procedure. In Brazil, I got the technique and the theory and the training of the product on everything, but I was the one that faced the patient. And so we came up with this technique, and what we do is, as you can see here, this is a cut of a penis. And what we do is, after numbing the penis, we open the skin with a needle, with an 18-gauge needle. And once the skin is open, we enter with a cannula, micro cannula, which is different from the needle. The needle is pointy and is very sharp. The cannula, on the other hand, is rounded and doesn't have any sharp points or anything. So that way we protect the veins and arteries that are on top of the penis, all over the place, but especially on top of the penis. And then we enter with the cannula in what appears here as in yellow, which is the areolar space. and is exactly where we inject the filler. A lot of patients ask if we can mess up the erection process with injection of fillers. We won't, because the erection process happens right in the center where you see the um, the cavernosal artery. There's a liberation of some substance there that triggers the erection. So it is completely different. The layer where we put the implant versus the the site where the injection, where the erection is triggered. And we go from the base of the penis all the way to the neck of the penis, right behind the corona of the glands.
That is where the product goes, where the filler goes.
Exactly. Where the yellow, where the yellow area.
Yeah, correct. You only have a limited amount of space and area to work on.
Right.
Yeah.
In that area, you don't mess with arteries or veins. You don't mess with the erectile organs. It is totally safe and isolated from vital structures or from functioning areas. Now, what we do once we numb the penis, we mark the penis and we divide it in areas, because we found out that when we used to go from the base of the penis all the way to the neck, the body tries to minimize the area of product that it doesn't recognize. So we ended up with those lines of product shrinking in the middle of the penis. So instead, we decided to go in sections, and depending on the size of the penis, we draw 6, 9, or 12 sections, and then we feel section by section, as you can see in that diagram. And then there are two approaches that we follow here. It all depends on different things. I mean, we're constantly making judgments on how to do each patient individually. But we can either use a gun and the micro cannula, as you see in the left side, or we can do manual injections using the cannula too. Right? But in the end, it's the same thing. It's just the preference of the physician and depending on the condition of the patient.
So again, the difference between just the manual cannula and the gun is just for what?
It's just preference of the physician. Yeah, the
But it's
cannula.
the same result.
Yeah, the gun has some advantages. Every click is a standard amount that comes out of it.
I see.
Yeah.
I
So
see.
for beginners, I will definitely recommend the use of the gun, because you
Okay.
standardize
Yes.
every click is
Standardized. Yes, correct.
and for the experienced physician, it doesn't really matter that much. You can go with manual injections.
With manual injection, it's basically a sculpture with you in
Exactly.
the art of it.
Exactly.
With the touch and the feel, and you already know how to modify.
Yeah, you palpate with a finger and you feel where you need to go and you go there.
Okay, very good. Yeah. Art in the medicine world.
Penile art.
Penile art. Correct. Yes. 17 years of experience, thousands of procedures, 85% high satisfaction rate, safe and effective, increase in popularity of temporary products.
Yeah, we have seen in later years that the trend is to go temporary or long term, and I definitely strongly support the idea of going long term. And there's a reason why. We all are going to age, and we age and we start having ailments and complications in life, and you will need to go to the urologist amongst other specialties. And I can tell you something: your urologist will be happier with a penis that doesn't have any fillers, right? So it is a good idea to, if you want to enjoy a bigger penis when you're young and use it, abuse it, do whatever you want. But eventually, when that itch settles, it's good to get rid of the product and be back into the basic structures. And because on the other hand, something happens, and the physicians are going to blame whatever is happening on the filler, and you don't want those situations. Now, if you understand that, and you think you're going to be okay with your doctor judging you because you have a modified penis, by all means, go for the permanent one. It's not going to create any health issues. It's just the appreciation of the physician. They go like, "Oh my God, what's here? What is this? Oh, you have this because you have the filler." Right? So if the patient is mature enough to understand what is the modification that he has, what is the product that he has, and what are the consequences of having that product, then by all means, permanent filler is totally fine.
So just to be clear, you're not going to have medical issues with the product. It's just that you're going to have some issues with the future doctor that takes a look at your penis when you're old, very old, and now he maybe not want to work with your penis. So you'll have to just know that some doctors don't like to even touch a penis with fillers. Not for medical reasons. It's just that they don't want to, but it's not a health issue.
Exactly. Is he or she can get confused. They don't understand the filler because the typical urologists don't understand fillers, right? So they're going to go like, "Oh my God, I rather don't touch you," or something. All of them are approved by the health authority, and all of them are safe to use.
Yeah. So all the risks that you just mentioned, they don't have to worry about that because this product is already checked and verified that.
Correct. We only use products that are sanctioned and authorized by the health authority.
Oh, okay. Yeah, very good.
Yeah, because sometimes you go out there and they will inject silicone, or I don't know. I've heard about, believe it or not, but there was a guy many years ago when I was starting this. There was a guy that was very popular doing injections, a guy, not a doctor, of baby oil. And of course, baby oil is a mineral oil that will create a lot of problems, rejection, and it's not injectable. It's baby oil, right? So, yeah, that's a good reason, or the reason, to look for a medical practice when you want to do this, and don't do it somewhere in the street, on the back of a gym or something like that.
Oh yeah, please don't put these fillers by yourself, because I've heard a couple of comments about this guy that wanted to ask, "Hey, how can I just put the fillers by myself?" You don't want to do that. You don't know how to. You can touch a vein, your urethra. Just don't be silly, people. Just go to the doctor and let it happen.
Right.
Like that.
You can play cardiologist too and cure your heart. Right.
So where can they find more information about this topic?
There are a few places. We a few years ago, actually many years now ago, we published in the Journal of Sexual Medicine. We published an article with 700 and something patients, and it's an article that was peer-reviewed. It's an article that is very serious and contains statistic information and a lot of information about PMMA specifically. And that was published a long time ago, as you can see. I think it was 2016. So you can always look for that article on the internet. We also have a book. It's a very basic, intended for all kind of readers, not for the medical field. A book that is called Girth Matters, the book, and that is available on Amazon, and it contains the whole thing, the whole information about the product is still up to date. And it's a good source of coming from us, from me in Avanti Derma, and is an experience of many, many years and thousands of patients treated. And to get the latest information, because we update these every 6 months, is our e-brochure that is an abstract of what is Girth Enhancement with all the new things that are around. And our e-brochure, you can always get it contacting Avanti Derma to info@avantiderma.com.
We see a couple of pictures. Do you have any examples?
Yes, sure. This is, first of all, sometimes patients ask for the gallery, the before and after gallery, and they want to see in erection, in relaxation, with PMA, with the lens, with HA. In reality, the result doesn't depend on the filler. If we're going to take a picture of a patient, it doesn't matter really if the patient has PMA, a lens, or HA, because you're going to see just volume. There's no difference, visual difference. So it doesn't matter again. Like in this case, we have a patient with made with Linea Avanti, which is Linea Safe too. It's the same brand. Linea Avanti is their trade name in Mexico. Linea Safe is a trade name in Brazil.
Okay.
And you can see the before and after is a very excellent
Yeah,
result.
it's an excellent result. Yeah,
Without
see.
being
Yes.
a monstrification, right?
Yeah.
It's just thicker, beefier, heavier.
Two different people, but at the same time, I know it's the same guy, but
Right.
it looks two different people.
Right. Now here, again, this is a very light, a very nice result. And again, nobody can tell that he has a filler.
Yeah, no, it looks totally natural.
Yep.
Yes, it looks very natural.
This is a series of photographs that a patient took after
4 sessions.
After 4 sessions, right? And but you can see the first photograph, his basic conditions. He was very thin and long.
Yeah.
And we were very conservative. We didn't go for volume. We went for logical, cool, nice increase.
I see.
And,
Yeah.
and after 4 sessions, and you can see there's the difference between session and session is not too much because we didn't use tons of product in this patient.
Yeah. No, he has a very good volume.
Mhm.
A lot of people are going to envy that. But the good news is that they can get it.
And as you can see in the last picture, if we continue increasing the size of the shaft, we're going to dwarf the glands.
Yeah, you don't want that.
Yeah. So I think the balance that he got at the end is what
Yeah, it looks
what
incredible.
is good. Right.
It looks very good.
Here's
The
another
lens,
example.
The same, very natural.
Mm-hmm. And you can tell by comparing the size of the glands, you can tell that there's no manipulation to make it
Yes,
look bigger than
it
what
looks
it
very
is.
natural, just as nothing had happened. He was born again.
All right. Now, complications. As I mentioned in the beginning, circumcise is very, very important in these patients. So we can do patients that have no circumcision, that's fine, but we need to approach them very, very cautiously. We need to do a very light volume, and because the moment we start feeling a penis that is not circumcised, we start creating volume that is movable.
Oh, okay. Yes.
So as you can see in the left picture, it is before retraction, but when you retract,
yes, you get
the filler
that
goes
effect.
with the skin because the skin is very movable. And in this patient, this is what we call the accordion effect. In this patient, the accordion effect was so big that it was almost interfering with penetration. So The cure here was to have the patient circumcised. And as you can see in the red lines, the mobility of the skin in the center is huge compared to the right, when the mobility of the skin is very limited. So that's the difference between, and it's the same patient, but that's the difference between doing a patient with foreskin or no foreskin.
Oh, okay.
Right.
Yes, thank you for clarifying. Yeah, it makes sense now.
Makes sense.
It makes sense now.
And then, of course, acute complications, we can always create hematomas and bruisings and things like that. Occasionally, this is a very rare instance, and it is something that both us doctors and patients need to be very careful, because you go home with an opening or 6 openings, and you need to take very good hygiene of the area. And we have had a few instances of acute infection that unfortunately is a combination of what we did, what the patient did. It's very difficult to point at what happened. But what we do is we do our best here, but then we ask the patients to do their best when they go home for the first 3 days to avoid complications. None of the infections that we have had along the years of experience have had any consequences. We just give them
That's good
antibiotics
news.
and then a chronic complication is asymmetry, irregularities. Like the first penis on the left is a little curved. Well, that is correctable with another session, and the penis on the right is a little
Okay.
irregular. Is not an ideal result. But again, you can soften up a little bit with a further session.
Okay.
And here is what we don't want to do. Patients that insist on having more and more and more, sometimes you go like, okay, I'm going to give you a little more, and then you regret, because patients get overcorrected. In these patients, you can definitely tell that they have a procedure done.
Yeah. Yeah, it looks. You don't want the girl to say, "Hey, what's that?" Or
What's that?
Or, yeah, that's the thing that you want to avoid.
Exactly.
You want to get in, out, and nothing happens.
Correct.
Yeah.
Yeah. So again, we can always, whoever is interested on this procedure can always contact us to get the e-brochure, which is the easiest thing to do. It's free. We send it by email. You get it in your inbox, and you can read all what it is. And if you have any questions, we offer Zoom conferences. There's always also the book available on Amazon, Girth Matters, and we're here to help. What we want is very educated patients that take a good decision when it comes to choose the filler.
Thank you very much, Dr. Casavantes, for your hospitality and this very interesting, useful information that I know a lot of guys in the internet are going to be really appreciative of what you've just given us today. Thank you very much. And as always, if you have any questions regarding this topic of what has been talked about, you can always leave a comment below on the video, and we'll make sure to show it to Dr. Casavantes so he can reply to you through via email or even on the comments itself. So thank you very much again for tuning in, and we hope to see you soon again. Thank you, Dr. Casavantes. We hope to see you soon again for another video about this amazing topic that a lot of guys are getting really happy, feeling really happy about their bodies, and basically just you're saving their self-esteem and sexual life, I may even say.
All right.
Yeah.
Thank you very much. It's been a pleasure.
Yeah, thank you.